Everyone, I am Dr. Swati Tandon. I am an ENT specialist practicing Sarita Vihar. Today I am going to talk about tonsillitis. Tonsillitis is inflammation of tonsils. Now this is a very common clinical problem. Tonsils are the lymphoid organs present in our throat. Each one of us has experienced an episode of tonsillitis in our childhood. Tonsils are the two lymphoid organs situated in the back behind our tongue in our throat, which is the area called as oropharynx scientifically. Now, these organs are actually meant for the immunity of our body to fight against the pathogens which enter our body through the oral cavity. On their lateral surface, on their surface which is facing the oral mouth, they have small openings which are called as crypts. Now these are meant to capture the bacteria or the pathogen and prevent them from entering the mouth lower down. So whenever there is any pathogen becomes trapped in these crypts, it gives rise to infections. Now acute tonsillitis is infection of these tonsils, and it is usually bilateral. Both the tonsils are usually involved. Now the symptoms of acute tonsillitis are fever, pain in throat, pain during swallowing, and a change in voice as well. Some patients might also experience pain referred to the ear, because ear and throat have a common nerve, so sometimes the pain of tonsils can be referred to the ear. Because examination is required for an acute tonsillitis, there are 4 kinds of tonsillitis. It could be acute follicular tonsillitis, acute membranous tonsillitis, acute catarrhal, or acute parenchymatous tonsillitis. Examination will rule out which tonsillitis a person has, and the treatment includes antibiotics, analgesics, and gargles. And it's important to maintain oral hygiene. Sometimes if it goes untreated, or sometimes if the treatment is not completed, then it can give rise to complications such as peritonsillar abscess, or the infection can spread to the whole body, giving rise to septicemia. Now, peritonsillar abscess is a very common complication if tonsillitis is not treated, and in this case there is abscess pus formation inside the tonsils, and then it needs a surgical management with admission in the hospital. So to avoid complications, it is very important to take treatment in time. And if your child has recurrent episodes of tonsillitis, which means that if he has more than 7 episodes in 1 year, or more than 5 episodes in 2 consecutive years, or more than 3 episodes in 3 consecutive years, and if he is taking antibiotics for all these episodes, then you must consider your child to get the tonsillectomy done, which is recommended by. So if your child is suffering from recurrent tonsillitis, then don't make them have antibiotics every year. Instead, we recommend tonsillectomy for such cases. Thank you.